Good day, everyone. I'm Dr. Sari Cooper, co-chair of the Family Practice Services Committee. I'm pleased to be here today to share with you more information about how FPSC funding supports for inpatient and long-term care are evolving to align with the comprehensive LFP payment model as it expands to include facility-based care. First, I'd like to acknowledge that the land on which I work is the traditional territories of the Lekwungen-speaking people, known today as the Esquimalt and Songhees nations, whose historical relationship with the land continues today. I encourage those of you watching to take a moment to acknowledge and express gratitude for the land you're joining from. In this recorded presentation, we're going to focus on changes to FPSC's inpatient and long-term care initiatives. These changes do not stand alone. They were developed in close alignment with the incorporation of facility-based care into the LFP payment model. The changes complement several other areas of work designed to strengthen family medicine, including team-based care, primary care networks, the provincial attachment system, locum programs, after-hours care, and digital health initiatives. To put the changes to FPSC supports for inpatient and long-term care into context, we're going to start with a brief recap of the LFP payment model itself. We will also provide information on the work to be completed in preparation for the launch of these changes, including engagement with divisions of family practice. If you're looking for more detailed information about how the LFP payment model is evolving to incorporate facility-based care, I encourage you to review the recorded presentation released on February 15th, which can be found on the Doctors of BC and BC Family Doctors websites. So now for a quick recap of the LFP payment model as it currently stands and as it expands. The LFP payment model that initially launched just over a year ago currently includes care provided in longitudinal family medicine clinics, maternity clinics, and home visits. With the expansion of the payment model scheduled for June 2024, longitudinal family physicians will be able to bill under the LFP payment model for care in the current settings, as well as inpatient care, long-term care facilities, palliative care facilities, and maternity care in hospital. The incorporation of facility-based care into the LFP payment model moves us much closer to our system-level goal of developing a comprehensive payment model for family physicians. Today, we're focusing on the changes in the FPSC funding supports for inpatient and long-term care. There are no changes to FPSC supports for maternity care at this time. Okay, so what you see here are the four key elements for the incorporation of facility-based care into the LFP payment model. You've got time codes, interaction codes, and the rural retention premium, which are all elements found in the clinic-based model. On-call and availability payments for family physicians providing facility-based care are a new element. The new on-call availability payments are not part of the LFP model itself, though they were designed with an understanding of how the LFP payment model's time and interaction codes work for facility-based care. For maternity care, the on-call availability payment is funded and provided through the Medical On-Call Availability Program, also known as MOCAP. For long-term care and inpatient care, the on-call and availability payments are funded and governed by the FPSC. This is an evolution of the FPSC's current initiatives in those areas of care. As part of its commitment to supporting and sustaining comprehensive family practice, the FPSC has been providing support for family physicians in delivering care in hospitals and long-term care facilities for more than a decade. Family physicians are essential to the delivery of care in many hospitals and long-term care facilities throughout our province, and FPSC's programs and initiatives have played an essential role in maintaining this service. However, as the system has evolved, it has become clear in recent years that the way these supports are delivered are often not adequate, equitable, or sustainable. The FPSC has been providing much needed bridge and stabilization funding over several years, pending a more comprehensive approach to supporting the delivery of care. With the development and expansion of the LFP payment model, we now have the opportunity to provide a more consistent, transparent, simpler, and more sustainable approach to FP compensation for care in these facility-based settings. This will, however, require an evolution of the current FPSC inpatient and long-term care initiatives. I'm now going to hand it over to Angie Chan, who will review the current supports and how these will evolve in alignment with the LFP payment model incorporating facility-based care. Angie, over to you.
Thank you, Sari. Hello, everyone. I'm Angie Chan, Director of Primary Care Transformation Initiatives for the Doctors of BC and FPSC. Before I dive into the changes to FPSC supports in long-term care and inpatient care, let's start with a quick review of current state. Since 2013, the FPSC has provided payments to family doctors for their commitment to maintaining relational continuity and coordinating inpatient care. Here is an overview of the payments. The FPSC provides an assigned network payment that goes to the physicians providing care to their own or their colleagues' patients while in hospital. The committee also provides unassigned network payments for family doctors providing care to unattached patients and/or patients that are attached to a family doctor that does not have privileges in the hospital. These unassigned network payments are administered by divisions of family practice. The FPSC also funds the FP Unassigned Inpatient Care Fee, or fee code 14088. This fee compensates family doctors for accepting most responsible physician status for an unassigned patient's hospital stay. And starting in 2018, the FPSC began providing time-limited inpatient care bridge funding and stabilization funding to help maintain service levels in communities experiencing critical challenges. As of 2023, the FPSC provides funding to divisions to support 49 hospitals across BC. These time-limited funds will continue until September 30th, 2024. Now, to long-term care. Since 2015, the FPSC has provided roughly $12 million annually to support long-term care through the Long-Term Care Initiative. This initiative, administered locally by divisions, aims to support physicians in providing care that is consistent with 5 best practice expectations, which are 24/7 availability, proactive visits, meaningful medication reviews, completed documentation, and attendance at care conferences. In addition, starting in 2023, the FPSC has been providing long-term care grants to individual family physicians in the form of $5,000 per quarter. These short-term payments are provided as part of FPSC's stabilization funding to help maintain long-term care services until billing for long-term care is available through the LFP payment model. The LTC grants continue until June 30th, 2024. Some support for being on call has been available for family doctors through the division-administered FPSC inpatient and long-term care funding described earlier. But the accessibility and amounts of such on-call payments have varied from community to community. The FPSC will now fund and administer new on-call availability payments for inpatient and long-term care. This funding recognizes the necessity and challenge of having a physician be available to respond to the care needs of patients in hospitals and long-term care facilities. They are intended to support the care of both unattached and attached patients. We know that call groups are often composed of family physicians who work under a variety of payment models for clinic-based care, as well as family physicians who do not provide clinic-based care. As a result, the new on-call availability payments will be provided for family physicians working under a range of payment models. They will not be limited to those physicians paid under the LFP payment model for their clinic-based care. The new FPSC inpatient care on-call availability funding will provide an amount of $182,000 per year per hospital for 24/7, 365 availability. This annual amount is aligned with MOCAP Level 2 payment. This on-call availability payment will be provided to divisions to administer and payable to all physicians participating in call, regardless of their payment model. The maximum payable per physician is $21 per on-call. While a physician is on call, all patient services they provide will be compensated by the LFP payment model or any other payment model, such as fee-for-service or alternative payment contract, that the physician is compensated by. The new FPSC inpatient care on-call availability payments are funded through a reallocation of ongoing FPSC inpatient care funding, which are the unassigned inpatient care network payment and the assigned inpatient care network payment. The new FPSC long-term care on-call availability funding will provide an amount of $130,000 per year plus $80 per long-term care initiative bed per division of family practice for after-hours availability. That is evenings, nights, weekends, and statutory holidays. This fixed annual amount of $130,000 is aligned to a prorated MOCAP Level 2 payment. And the variable amount of $80 per LTCI bed is meant to reflect the volume of call needed. This on-call availability payment will be administered by local divisions and payable to all physicians participating in call, regardless of their payment model. The maximum payable per physician is again $21 per on-call hour. While a physician is on call, all patient services they provide will be compensated by the LFP payment model or any other payment model, such as fee-for-service or AP contract, that the physician is compensated by. The new FPSC long-term care on-call availability payments are funded through reallocation of the long-term care initiative funding that is currently allocated to physician clinical payment. In addition to the new FPSC on-call availability funding, the FPSC will be providing a new payment for family doctors who provide long-term care and are not eligible for the LFP payment model. There is a significant proportion of long-term care services currently provided by family doctors who are not eligible for the LFP payment model. Through this new payment, the FPSC aims to help maintain long-term care services when the LFP payment model for facility-based care is introduced. Family physicians participating in the long-term care initiative who are not eligible for the LFP payment model will be able to claim an amount of $290 per long-term care initiative bed per year for which they are the most responsible physician, up to a maximum amount per physician per year. This payment is intended to help family physicians who aren't eligible for the LFP payment model to maintain their long-term care services. The new FPSC long-term care payment is also funded through a reallocation of the long-term care initiative funding that is currently allocated to physician clinical payments. Okay, I've presented a lot of information. Let me try to summarize all these changes from current to future state. Let's start on the left of this table with inpatient care. In the current state, family doctors predominantly bill fee-for-service for inpatient care. In addition, the FPSC has been providing the assigned inpatient care network payment, 14086, to physicians, the unassigned GU inpatient care network payment, administered by divisions, the unassigned inpatient care fee, 14088, for physicians, and the stabilization bridge funding administered by divisions. This stabilization and bridge funding will continue until September 30th. In the future state, billing for LFP inpatient care time and interaction codes will begin in June. FPSC inpatient care on-call availability payments will begin in July, including additional administration funding. And the FPSC unassigned inpatient care fee, 14088, will continue to be available for fee-for-service doctors. Looking to long-term care, In the current state, family doctors predominantly bill fee-for-service for long-term care. In addition, through the Long-Term Care Initiative, the FPSC has been providing physician compensation in the form of MRP payments and some on-call payments, quality improvement funding, and administration funding. The FPSC also provides the long-term care grant, which will continue until June 30th. In the future state, billing for LFP long-term care time and interaction codes will begin in June. The new FPSC long-term care on-call availability payment will begin in July, including additional administration funding. Long-term care initiative, quality improvement, and administration funding will also continue, and the new long-term care payment for fee-for-service physicians not eligible for the LFP payment model will begin in July. These and other operational details are available on the FPSC website and will continue to be updated. Please check the website regularly. Sari, back over to you.
Thanks, Angie. So that's quite a bit of information. What we've shared with you in this presentation represents significant critical health system changes that we believe will continue to move us toward empowering family physicians to provide accessible, high quality, comprehensive, and continuous care that adapts to meet the needs of their patients and their communities. As we move forward to implement this payment model, we will be working together with divisions of family practice to realize the full potential of these system changes. Divisions of family practice will continue to play a fundamental role in supporting facility-based care. I want to emphasize that. It's really important. They will be responsible for administering the new on-call availability payments and will support physicians in organizing call groups. FPSC will continue to provide funding for administration to support divisions in this work. We recognize that the way these supports are structured may be a significant shift from how they have worked in the past. The FPSC will look to divisions to provide feedback and information to help us understand the impacts of these changes and to continue to improve how we collaboratively work together to support physicians and patients and the system. Significant work is underway to prepare for the launch of the LFP Payment Model facility-based codes and the new changes to the FPSC initiatives in long-term care and inpatient care. We are committed to supporting divisions of family practice during this transition. To start, please be on the lookout for information on Q&A sessions with divisions that we will host over the next couple of weeks. Registration information will be emailed to the division executive directors and physician leads. We are also working to clarify processes and to develop resources to support these important system changes. Thank you for taking the time to watch this recording to learn about the upcoming changes to FPSC's initiatives and supports for inpatient and long-term care. As more information and resources become available, we will keep you informed via Division's dispatch. In the meantime, if you have any questions about the information in this recording, please reach out to fp.billing@doctorsofbc.ca.